Hello, my name is Bailey Vanderhoof. I'm filming my head-to-toe assessment for my final practicum for health assessment. So first, I just want to note that I'm in appropriate attire. I have my ID, I have my name tag on, I do have my white shoes on as you'll see. I have my stethoscope for the cardiac and respiratory assessment, and I have my pen light for the eye exam and the neurologic exam. So my boyfriend was kind enough to be my patient for this, and we are making the hospital my living room. So I'm gonna do a quick environmental check just to ensure that there is nothing helping me or aiding me, guiding me on what to say. Alrighty. So you can come in.
Okay.
I'm gonna draw my hands. Hello, my name is Bailey. I'm gonna be your nurse today.
Hello.
I will be performing a head-to-toe assessment. Is that okay?
Yep.
So I'm gonna sit right next to my patient. I've gelled my hands, I've introduced myself, and I've shown that I'm in appropriate attire. I'm gonna show you respect the whole time. Nothing during this assessment should hurt, but if something hurts or feels uncomfortable, just let me know. Everything is going to be confidential. The only people that will be able to access your health record is anybody on your treatment team.
Okay.
I'm going to provide privacy by closing the curtain. Can you verify your name and date of birth for me?
My name is John Costa. I was born September 24th, 1998.
Okay. And then, do you feel safe right now? You don't feel like you're going to fall?
I feel safe.
Okay. So I've assessed their safety, privacy, confidentiality, respect, and all of that. So now I'm going to ask you questions as I go through each individual assessment. So first, we're going to start off with the general survey. How are you feeling today?
I feel good.
Good. Do you have any loss of balance, coordination?
No, nothing.
No. Have you had any problems with memory lately, short-term, long-term?
No.
Okay. So as my patient walked in, I already assessed his gait. It was smooth and steady. It was normal, no indication of any lack of coordination or balance. Right now, sitting, his posture is erect and he's sitting on the couch. His facial expression, mood, and affect are all appropriate for the situation. So his facial expression is pleasant, he's articulating clearly, and his speech is paced. He seems very well groomed, his hygiene is adequate, his dress is appropriate for a physical examination. So then his nutritional status appears to be adequate. He does not appear to be malnourished or overweight, underweight in any way. He looks to be the appropriate weight for his height. So then I'm just gonna ask you a few questions to assess your cognitive right now. So what's your name?
My name is John Costa.
Where are you right now?
I'm in your home.
Approximately what time is it?
It's around noon.
Good. So my patient is alert for consciousness and he is oriented to person, place, and time. So then in an older adult, I may smell an odor coming from them if they have problems with hygiene. They may appear malnourished if they live alone and they're having difficulties eating. And I also may notice a wider, unsteady gait when they walk in. So now moving on, I'm gonna do your neurologic and musculoskeletal exam.
Okay.
So have you had any numbness, tingling in your extremities, your fingers, your toes?
No.
Any recent severe headaches?
No.
No. Any dizziness, vertigo?
Nothing like
Nothing? Okay. So I'm just gonna shine a light in your eyes just to
Okay.
assess if your pupils react appropriately. So please just look over my shoulder,
that. Okay.
stare into the distance. Alrighty. So I'm going to document Perla bilaterally. His pupils are equal, round, and reactive to light and accommodate as they constricted when the light was in them. So now I'm going to check your muscle strength and tone. So can you just grab my hands and squeeze as hard as you can? Good. Can you resist my hands? I'm going to push down. And then can you put your arms up? I'm going to push, you resist. All right. So I'm going to document that his strength is 5 plus, normal, strength, strong, equal bilaterally. Can you lift your feet up, your legs up? I'm going to assess your feet at the same time. So can you just push down like a gas pedal? Good. So I will document that his lower extremities are also 5 plus, strong, equal bilaterally. In an older adult, I may see weak muscle tone and strength, and they may have frequent severe headaches. Maybe they have a neurological disease, or they may have numbness and tingling in their fingers or their toes. So now moving on, can you take your sweatshirt off? I'm just going to assess your respiratory system. Have you had any shortness of breath lately?
Nope, not at all.
Any cough?
Nope.
Do you have a hard time breathing when you're laying flat?
No, I do not.
All right. So now I'm going to do a series of breath sounds. So I'm going to do it in the front and then I'm going to do it in the back.
Okay.
It shouldn't make you feel dizzy at all or lightheaded, but let me know so we can stop.
Okay.
All right, deep breath for me. Two more. Okay, so now I'm going to do the back. All right, deep breaths again. You don't feel dizzy?
No.
Okay. One more. Okay, good. So, as I was doing that, I've already assessed my patient's respiratory rate. His respiratory status is normal, effortless. His respiratory rate is 16, which is in the normal range of 12 to 20. His lung sounds are clear bilaterally. There's no adventitious breath sounds such as crackles or rhonchi. I don't hear any wheezing. He appears to be in no respiratory distress on room air. And he has no history of any respiratory problems. So in an older adult, I might hear some adventitious lung sounds. They may have a history of respiratory problems such as COPD. Maybe they have short of breath and they can't tolerate laying flat. So now I'm going to move on to your cardiac exam. I'm just going to listen to 5 of your cardiac landmarks, and I'm going to listen to one for 1 minute. And then I will listen with both my diaphragm of my stethoscope and the bell of my stethoscope.
Okay.
Have you had any chest pain?
No, I have not.
No? No pain in your jaw or your shoulder?
No, nothing
No
like that.
fluttering or palpitations?
Nope.
Okay. So the 5 cardiac landmarks is going to be the aortic, pulmonary, Erb's point, tricuspid, and then the 5th intercostal space, mid-clavicular, is going to be the mitral, which is where the apical pulses. So first I'm going to listen with my diaphragm. So I'm going to find the 2nd intercostal space, which is going to be the first one, the aortic. So just breathe normally for me.
Okay.
And then I'm going to go right over to the pulmonary, down a little bit to Erb's point, then tricuspid. Here at the tricuspid, S1 is the loudest. And then I'm going to go to the mitral, the apical. I'm going to listen for 1 minute. So I'm going to note that S1 and S2 was noted in each point. Now I'm going to go to my bell because I want to listen for any heart murmurs. So I'm going to do the same thing. I'm going to start at the aortic. Just breathe normally again. Herb's point, tricuspid, and then the mitral valve apical pulse, where I'm going to listen for 1 minute again. So after listening for a minute, I'm going to note that there was no heart murmurs. S1 and S2 was present. No heart murmurs. Tricuspid was where S1 was the loudest, and his apical pulse was normal. It was 70. Normal is 60 to 100. So I'm going to also check your radial pulses when I'm here. His radial pulses are strong, 2+ equal bilaterally. So now, in an older adult for cardiac, they may be fatigued easily by walking up the stairs or into a room. They may have an extensive cardiac history. Maybe they've had some chest pain. Maybe they're on some medication for chest pain, and they may have some palpitations or heart murmurs. So now I'm going to have you lie flat. I'm going to inspect your abdomen if that's okay.
Yep.
Have you had any abdominal pain?
No.
Any diarrhea, nausea, vomiting?
No, nothing
No
like
change
that.
in bowel movements?
No.
Okay. So the first thing I'm going to do is inspect the abdomen. Then I'm going to listen to the bowel sound so that I don't want to do palpation first because I don't want to interrupt that. So can I pull your shirt up a little?
Yeah.
Okay. So I'm just going to inspect the abdomen first. So I'm going to look at the color and the contour, and I'm going to notice that it's appropriate. It's evenly distributed. It's appropriate for the ethnicity. The hair is evenly distributed throughout the whole abdomen. I'm not noticing any masses, lumps, bumps, lesions, cuts, bruises. I'm going to check skin turgor, so I'm just going to lift up, pin, pinch. Is that okay?
Yep.
So I'm going to note that the skin turgor recoils immediately, which is adequate. So now after assessing symmetry, color, skin turgor, I'm going to listen. And again, we listen second so that we don't interrupt the bowel sounds. So I'm going to listen to bowel sounds in all 4 quadrants, starting in the lower right quadrant where bowel sounds are most active. And I'm going to go in the appropriate order. And I'm going to document that bowel sounds are normal and active in all 4 quadrants. They're not hyperactive. I don't hear anything abnormal. So now I'm going to percuss your abdomen. So I'm just going to tap over all 4 quadrants. It shouldn't be painful, but just let me know if it does. Okay, so I will note tympany over all 4 quadrants, no dullness noted. I didn't feel any masses, lumps, bumps, anything like that. So now I'm going to palpate. Again, this shouldn't hurt. Does this hurt?
No.
Does this hurt?
No.
Does this hurt?
No.
Anything here?
No.
And then I'm just going to palpate a little bit deeper. Anything hurt?
No.
No? All right, you could put your shirt back down. So I'm going to note that there was no masses, lumps, bumps felt. There was no rebound tenderness at all. So then I'm going to have you sit back up for me. So in an older adult for the abdomen, I may notice that they have some diarrhea, maybe they have nausea, vomiting, maybe they have some rebound tenderness. So now I'm going to assess your legs. Can you just pull your legs up to your knees, your pants up to your knees, and take your socks off for me?
Yep.
So with peripheral vascular, have you noticed any swelling?
No.
Any discoloration to your lower extremities?
No.
Any pain in your lower extremities?
Nothing like
Okay.
that.
I'm gonna have you just lift up your legs a little so the camera can see you. So I'm going to assess the color, temperature, and moisture. So the color is appropriate for ethnicity in his arms and his legs. I'm going to feel the temperature in his legs and his feet and his arms and hands. So I'm going to note that the temperature is warm bilaterally in both his upper extremities and his lower extremities. I'm going to note that there's no lesions or any cuts. There's no swelling. There's no edema. There's a little bruise here, but that could be from his occupation in construction. So there's no excessive moisture. His skin is warm and dry and pink, so everything is adequate. So now I'm just gonna check your pulses. So I've already checked the strength and muscle tone in the feet. Now I have to check the pulses. So I'm going to check the dorsalis pedis. And I'm gonna do that bilaterally. And then I'm gonna check the tibial pulse. Also bilaterally. I've already assessed the radial pulse. So I'm going to document that the pulses are 2+, strong, equal bilaterally. I also note that I don't see any varicosities, varicose veins, anything like that. Everything seems adequate, no swelling. So now you can put your feet back down. In an older adult, I may have a hard time finding their dorsalis pedis pulse, so I might have to get a Doppler to find it. I might notice some swelling, redness, edema, maybe their skin is cool to touch, or maybe there's a discoloration in the lower extremities. But for peripheral, I've assessed the pulses, color, temperature, moisture, and it concludes our final assessment. Do you have any questions for me? No? So I would make sure that my patient's comfortable before I leave the room. I'm going to document all of the findings that I found. There was nothing abnormal.
Okay.
So I will document that so all of your other healthcare professionals can access it if needed. I'm going to gel my hands, make sure that the patient has a call bell, that the bed is down, side rails are up if they were to be in the hospital. And that's it.